Maybe some of our others are on.
Yeah, they're on.
All right. The Health and Human Services and Aging Committee meeting is now called to order. Chrissy, if you please call the roll.
Calling the roll, Mr. Jones.
Here.
Ms. Conwell.
Here.
Ms. Brown. Mr. Schron. Mr. Schron is absent. Mr. Miller.
Here.
We have a quorum.
Chrissy, has anyone signed in for public comment?
No, Mr. Chair, no one has signed in.
All right. Can we have a motion for the approval of our minutes from the March 4th meeting?
Second.
Moved by Councilwoman Brown, seconded by Councilman Miller. All in favor, say aye.
Aye.
Aye, the minutes are approved. All right. Well, Chrissy, if you read our first item on the agenda.
Resolution 2015-0051, a resolution authorizing an agreement with Cuyahoga County Treasurer's Office in the amount not to exceed $42,307.74 for child support services for the period 1/1/2015 through 12/31/2015, authorizing the county executive to execute the agreement and all other documents consistent with this resolution, and declaring the necessity that this resolution become immediately effective.
All right. And can we have a motion to excuse our council member, Jack Schron?
So moved.
Moved by Councilwoman Conwell, seconded by Councilwoman Brown. All in favor, say aye.
Aye.
Ayes have it. Someone would like to speak to the resolution before us? Good afternoon.
My name is Deborah Watkins, and I'm the Executive Director of the Office of Child Support Services. I'm sorry, thank you. All right. Good afternoon, Mr. Chair. My name is Deborah Watkins, and I am the Executive Director of the Office of Child Support Services within the Cuyahoga Job and Family Services. I'm here to answer any of your questions today on this resolution and the other resolutions for the Title 40 contracts. The Office of Child Support Services each year collects about $241 million in child support, and we serve about 128,000 cases. 1 in 3 children are touched by the Office of Child Support Services, and that includes also 1 in 2 children who live in poverty. We provide valuable family support services, including establishing paternity and support orders, adjusting support orders to match the family's current financial situation, and enforcing support orders, and providing other case management services. This work really could not be done without our child support partners, including the Treasurer's Office, the Domestic Relations Court, the Juvenile Court, and the Prosecutor's Office. This first resolution is to approve a Title 40 contract that would allow for the county to be reimbursed 66% from the federal government for the services provided by the Treasurer's Office when they collect the cash child support payments for us. Thank you.
I see the contract is dated January 1. What was the reason for the delay in?
Thank you. Yes, Mr. Chair, the delay in providing bringing this contract forward, we have to work with the State Office of Child Support to get the language of the contracts approved, to get the performance standards in place, and that was the reason for the delay.
Have services been delivered since January?
Yes.
So the vendors are waiting to be paid?
Yes.
Okay. All right. Any questions from the committee?
Councilman.
Councilwoman?
Through the chair to Ms. Watkins, so the 42,000 some odd dollars, that's what we're being reimbursed?
Through the chair to Ms. Conwell, yes, that is correct. That's the 66% reimbursement.
Okay, so that means we put, really all the providers have been paid for from our funds or whatever, and then we get reimbursed.
Exactly, yes.
I'm just wondering how that shows up on our budget. Thank you, Ms. Watkins.
Any further questions from the committee?
Mr. Chair,
Councilwoman?
I just wanted clarification. You said how much do we collect a year in child support?
Through the chair to Ms. Brown, we collect $241 million a year.
Okay, I thought that's what I heard. Thank you.
Thank you. If I could clarify, though, that's not just cash payments through the Treasurer's Office. That's total collections of child support.
Any further questions from the committee?
Mr. Chair,
Councilwoman?
to Ms. Watkins, 241 million from fathers and mothers.
Yes,
Okay.
correct.
Just for Cuyahoga County?
Just for Cuyahoga County, yes, correct.
Okay, different, and I'm sure there's different rates that different ones pay. That's a lot of moolah.
Yes, if I may, through the chair to Councilwoman Conwell, that is correct. Parents pay based on an income shares model in child support, where we calculate, or the courts calculate, how much child support should be paid based on the Ohio Child Support Guidelines. So child support is calculated based on the financial circumstances of the parents,
And,
pursuant to Ohio guidelines.
and out of this 241 million, that's not all count. We have to allocate that to other services, correct? Like if, I'm assuming that if one parent is on food stamps or Medicaid or something like that, there's some kind of reimbursement from us to those other agencies?
Approximately, I'm pulling this number from memory, so please excuse if this is not the exact number, but approximately 92% of all child support payments are actually dispersed to the family. So child support is a unique government-private relationship where it's mostly a private transfer of money between the families. If someone is on public assistance and receiving a cash benefit, then that child support is assigned currently to the state of Ohio. So when we collect that child support payment does go back to the state of Ohio. And if someone is also on Medicaid and we collect a cash medical payment, then that payment is also assigned to Medicaid and goes back to the state of Ohio. But if someone is on food stamps or one of the other public assistance categories, there's no assignment of the child support, and the child support gets dispersed to the family.
Thank you.
Any further questions? If there are no further questions, I'll make a motion that we move this resolution to the full council under second reading suspension. Moved and seconded by Councilman Miller. All in favor, say aye.
Aye.
Aye. Ayes have it. Chrissy, if you read our next resolution.
Resolution 2015-0052, a resolution authorizing agreements with various providers in the total amount not to exceed $7,587,891.68 for child support services for the period 1/1/2015 through 12/31/2015, authorizing the county executive to execute the agreements and all other documents consistent with this resolution, and declaring the necessity that this resolution become immediate effective for the providers and amounts as printed on the agenda.
And if you'd like to speak to this item as well.
Thank you. Mr. Chair Jones, this resolution is authorizing the same Title 4D contracts be entered into with the Domestic Relations Court, the Prosecutor's Office, and the Juvenile Court. All three of these providers are partners in the child support program. They help us when we need to establish support orders judicially, when we need to enforce support orders judicially, or when we need to establish paternity judicially. So it's very important that we have these relationships with the courts so that families can receive the vital family support services that they depend on us to provide. We would request that these Title 4D contracts be entered into so that, again, the county can receive the 66% reimbursement when the courts or the prosecutors are also providing Title 4D services.
Mm-hmm. Give me a sense of how many court orders are provided over this time period, I guess projected.
If I may have just a moment, I need to look to see if I have that. Mr. Chair, I may need to provide that information to you.
Okay.
However, if I could, each month we process approximately 1,200
Okay.
orders through our financial operations unit. Some of those are administrative orders and some of those are judicial orders, if that gives you an indication.
does.
And then I could certainly follow up and provide you with the exact
It's roughly
numbers.
1,200 a month. Any sense also for the proof of paternity? Does that tend to be, is there a certain percentage?
If I may look back, I
Sure.
have with me
You can
also
use your
Rick
lifeline.
Weiler with the, thank you,
Yes.
with our financial office, and also Steve Ritz with our prosecutor's office. Steve, do you have the numbers of paternities that we do through the prosecutor's office?
Court
Okay, I apologize for that delay. Through the Domestic Relations Court, we purchase approximately 8,500 units, which would be the number of the orders provided. Through Juvenile Court each year,
And that was 8,500 for the.
For
that
the
would-
year.
For the year.
yes, thank you. And 16,000 units are purchased through the Juvenile Court contract. And through the prosecutor's office, we do the units based upon number of hours, and we purchase approximately 50,000 hours of service through the prosecutor's office.
Thank you. Any questions from the committee? Councilwoman?
Through the chair to Ms. Watkins, 66% is reimbursed. How much does the 34% of our cost come out to?
If I may? Do you have the,
About $3.5 million.
approximately $3.5 million.
3.5? Does that come from our HS levy fund?
Those would, does that come, I don't think that comes through the HHS.
That money is just part of the approved budgets prior to the process. So those are the approved budgets for domestic court, juvenile court, and the prosecutor's office for the separate budgets for child support. When we get the money back in and we get the 66% back in, it goes back into that specific budget as revenue in each one of those budgets.
Okay, so the 3.5 million is divided up between the three? All right, thank you.
Councilman Miller?
Thank you very much. And could you tell me a little bit about what the actual services are that are provided by the agencies for receiving the money, and how the cost of services is calculated?
Yes, thank you. Through Mr. Chair Jones to Councilman Miller, yes, the prosecutor's office is providing several layers of service. The prosecutor's office provides legal advice on child support issues. So if we need to interpret a court order that we've received, they are helping us make sure that we implement it properly if there's a question. Also, we are able to establish support orders and paternity orders administratively. However, there are times where we're either mandated to go to court to establish a support order or establish paternity, or we haven't been able to secure cooperation through the administrative process. And at those times, then the prosecutor's office will file a complaint to determine paternity, a complaint to establish a support order through the juvenile court primarily. And then the juvenile court will then hold hearings to establish paternity, to establish support orders for the parents to pay child support. In addition, once enforcement is needed, if we have not been able to secure child support payments administratively and we've exhausted all of those remedies, we then have the ability to go to court, and the prosecutor's office is filing the contempt actions, the motions to review the purge payments, those types of judicial remedies. And then the juvenile court and the domestic relations court will hold the contempt hearing, determine whether or not the person is in contempt, and make the appropriate sentencing finding. So they're providing enforcement actions. There are also a host of other remedies that we have through the judicial system, such as motions to attach lump sums. So if somebody has received a bonus payment through their employer and they are behind in their child support, we can obtain that lump sum payment, but that requires that the court sign off on that order. So there are a host of remedies such as that that the prosecutors and then the courts are reviewing and signing off on.
Okay. And of the people who owe child support, could you give me a ballpark estimate of what percentage pay what they owe with very little difficulty, and what percentage pay what they owe, but the court has to get involved and maybe has to attach wages or do some of the stuff that you were talking about, and then what percentage is out there that's that even despite our very best efforts, they don't pay.
Yes. Mr. Chair, through Mr. Chair to Councilman Miller. I'm not sure that I can accurately convey how many parents can pay it without difficulty. However, each year, one of the performance measurements that we are measured by is how much current support we collect during the month that it's owed.
Let
and
me-
we collect
Let me rephrase the question. I'm not talking about what their ability is to pay. What I'm saying is what percentage have a high level of compliance.
Okay.
In other words, they pay what they owe without us having to take any extraordinary measures, and what percentage pay what they owe and or most of it, but some poking and prodding is required, and then what percentage just don't pay or don't pay very much of it.
Okay. Just over 60% of the child support is collected during the month that it's owed. And so I believe that 60% is roughly the percentage that pays on a routine basis through an income withholding order. We're required to issue an income withholding order for every child support case now. And so roughly 75 to 80% of the money that we collect comes in through an income withholding order. I would say the remaining 40% requires substantial case management services where we're trying different remedies. We're trying to see if payment reminders will work, and then we're also working with the Fatherhood Initiative to get people connected to employment services if there is a barrier to employment. I'm not sure that I have the exact numbers to break down which is refusing to pay and which it just requires additional services because they have a barrier to payment. I could certainly provide that information to you, though.
Okay, that's a good start. Thank
Okay.
you.
But at some point, for those that aren't compliant, the prosecutor's office gets involved. They
Yes.
make arrests.
There can be an arrest made. Mr. Chair Jones, yes. If we will first try to exhaust all administrative remedies first, make any referrals to community services if there's a barrier to pay. But then, yes, if somebody is refusing to pay the child support, we will file a contempt action. If they fail to appear for the contempt action, a capias can be issued for their arrest, and they can also be sentenced to jail. If somebody continues to fail to pay support for 26 weeks out of a 2-year period, they can also be charged with a felony of criminal non-support, which can also result in either community control or prison time.
So a failure to pay for 26 weeks out of 52 or 104 weeks.
Yeah,
104 weeks
yes,
could trigger that, obviously,
yes,
a potential felony charge.
yes. That does not mean that at 26 weeks that we are automatically filing criminal non-support, but yes, that can trigger a criminal non-support charge.
Okay. I'd like to know a number, and I don't have to have it now if you don't have it, but what that number of how many of those who do not comply and those charges actually come against them.
Okay, and Mr. Ritz do you have the number of contempt actions that? I will have to. Okay, we will do that. We will certainly do that. In the last year, we've been working very diligently with the juvenile court, and I am very pleased as part of this contract process that juvenile court has really been working with us to make the contempt actions more streamlined, and we've been working internally to make sure that we're screening contempt actions appropriately. So we have not been filing contempt actions for the last year in juvenile court, but we'll begin to resume those this year. And that allowed them to clean up a substantial backlog in contempt actions also.
Any further questions from the committee? Councilwoman?
Through the chair to Ms. Watkins, I'm assuming that it must be a small amount that refuse to comply. Is jail the only remedy for those, that small percentage that just for whatever reason doesn't comply?
Through the chair to Councilwoman Conwell, I'm very excited to tell you about a program that we are just now getting off the ground because jail has been the remedy used if somebody's refusing to pay. But we know that through research that offering individuals the opportunity to get connected with employment readiness programs can sometimes lead to improved results. And so we are getting ready to kick off what we're calling the Child Support Improvement Project, which is a collaboration between the courts, the prosecutor's office, and our office, where we're going to be offering very intensive case management services, as well as referrals into the Fatherhood Initiative programs, including the employment readiness programs, so that if they go through a 4-week program and continue to follow up with us and meet some accountability timeframes and guidelines, that will be an alternative to going to jail when they're not paying.
Are there any discussions in regards to those, I know the law changed a little bit, but for the individuals that were put in jail and now have a record for child support and only child support, is there any discussion of how we can reverse those? Because those individuals now have a barrier for a felony and they can't get a job.
Through the felony expungement law, and I apologize because I'm forgetting the Ohio Revised Code citation for that, but through that, the child support is the child support felonies are now able to be expunged as long as there hasn't been some type of abuse of the child. And I know that a few of the programs that we work with are actively working on expunging those records.
So when we talk about expungements, sometimes records still slip through the cracks, and employers see that information. I think we need to. It's a crime for the child
It is.
that that's not getting taken care of by their biological parent, but. When you have to weigh what's worse of a crime, between two crimes, I just think we could do more than expungement, because I know for a fact that those records slip through the cracks sometimes, and I don't know how many jobs out there look at that as a deterrent for certain positions. So. Real eager. That would be something more state, probably, huh?
Well, I believe that through some collaborations between the child support program and the DRC, that some of these issues have been addressed. I believe that there's also a certificate of employability that the person can
Aware of
obtain, and that can be helpful. I believe that we also, through one of the programs that we work with, they work very closely with people who have felonies in their record. Towards Employment is one of the programs that we work with, and they have many services that they can offer to help somebody who has a felony on their record in obtaining employment.
Do we have is there an exact number of how many, cases that we have that are just strictly child support?
That they only have a child support felony record. I've seen that number. I do not have that number with me today.
Could you provide that
I
for
certainly
us?
could.
I'm just wondering if some way that we can reach out to those individuals and let them know about the certificates of the things that we've changed, some outreach for that.
I think that's a great idea. Thank you.
Thank you. When someone commits a crime, we uphold the law. Someone has committed a crime, you have to pay the penalty.
Yes.
But I do believe once you have paid that penalty and you have paid your debt to society, then you should have paid your debt to society. There should not be additional debts, and that's really what we're seeing. There are additional debts after you have paid your debt, And we have an opportunity here, I believe, to see what we can do to help people to be economically viable, because that's what we're really talking about. That additional debt is making it difficult for people to be hardworking, tax-paying citizens. And these health and human service dollars really are meant to be an engine, an economic engine, helping people to be self-sufficient. So whatever this council committee can do to be a part of helping that process to be more efficient and effective, I think you have support here. Councilwoman Brown.
Thank you, Mr. Chair. You mentioned that there will be an intensive case management service with regards to the child support improvement program, and I'm just wondering, have additional funds been allocated to or budgeted for that, or is that something you foresee you'll have to come back before us?
Thank you. Through the chair to Councilwoman Brown, no additional funds have been allocated at this time.
And I see 34% local sources. Is that strictly the county?
Yes.
Okay, and one last question. It says the contracts are currently 100% FFP funded. If you could just help me understand that, I'm sorry.
Absolutely.
Okay, thank you.
No, FFP stands for Federal Financial Participation, and that simply means the 66% that we can have reimbursed. So child support is supported at the federal level also, and we are able to draw down a 66% reimbursement rate from the federal government. And so FFP simply refers to that federal financial participation where they will reimburse 66% of allowable charges. Does that, I'm not sure that I've completely gotten it yet though. The numbers that are presented in the resolution represent the full 66%. So there's an additional 34% that is met through local share. So the amount in the resolution is 100% federal financial participation, and that's the 66% reimbursement. Thank you.
You mentioned that you partner with the Fatherhood Initiative. Is there a financial relationship? How are you providing the funding? What is that relationship?
Thank you, Mr. Chair. Yes, the Fatherhood Initiative is actually housed in the Office of Child Support in the Cuyahoga Job and Family Services. Currently, the Fatherhood Initiative is paid for 100% with HHS levy dollars. And so at this time, there are not child support dollars that can be used to fund the Fatherhood Initiative.
This contract is annual. How has it changed over the years? Is this $7 million been stable over the past few years, or has it gone up or decreased?
I don't have over the last 7 years, but Mr. Weiler may have over the last 7 years. From last year to this year, for example, the Domestic Relations Court last year was 2.4 million, and this year it's 2.6. The Juvenile Court in 2014 was 2.6 and is 2.6 this year. The Prosecuting Attorney's Office was 3.1 last year and is 3.2 this year. And the Treasurer's Office was 59,000 last year and 62,000 this year. For the total, 100%.
Is there a unit cost, or are the changes based on demand, or?
Some of it is based on demand, some of it is based on increases in salary line items, things like that. And some of them are slightly increased due to a slightly higher hospitalization. For example, in domestic relations, they saw a staffing increase. So yes, normal within the budget type increases.
Any further questions from the committee? If not, I'll make a motion that we move this resolution to the full council, again under second reading suspension.
Second.
Seconded by Councilman Miller. All in favor, say aye.
Aye.
Ayes have it. And Chrissy, and thank you.
Thank you.
And Chrissy, if you read our next resolution.
Resolution 2015-0053, a resolution authorizing an amendment to contract number CE 13-00099-01 with Lutheran Metropolitan Ministry for emergency shelter services for homeless men located at 2100 Lakeside Avenue, Cleveland, for the period 1/1/2013 through 12/31/2015, for additional funds in the amount not to exceed $1,701,638, authorizing the county executive to execute the amendment and all other documents consistent with this resolution, and declaring the necessity that this resolution become immediately effective.
And Ms. Gillette, if you'd like to speak to this resolution?
Good afternoon, committee members. I have there it is, thank you so much. Ruth Gillette, Office of Homeless Services, presenting the R 2015-0053 for an amendment to the Lutheran Metropolitan Ministries contract to maintain the shelter operations through 2015 at 2100 Lakeside Avenue. The initial contract was awarded in 2013, so this is the second contract amendment for an annual appropriation. The contract funding source is 100% Health and Human Services levy dollars. Other funders include the City of Cleveland, the VA, Ohio Development Services Agency, United Way, FEMA, and other funders that Lutheran Metropolitan Ministries identifies, for a total operating budget of $3.3 million. The reason for the late submittal is that because these are 2015 dollars, we have to wait until January and the funds are appropriated to access them for 2015 contracts. 2100 serves approximately 400 men a night. They provide showers, meals, and laundry for the clients. As you can imagine, with 300, almost 400 men there, they've organized the interior of the shelter by communities. So, for example, there's a veterans community. There's a community specifically for mentally ill and vulnerable populations. There's an effort to have a community of people that are trying to pursue sobriety, that kind of thing.
AOD stands for?
Alcohol or drug addicted. Sorry. So in the client profile, again, there's, between 300 and, but the average through HMIS is about 379 clients a night. During 2014, there were 2,189 unduplicated people served.
So that means you served a higher number of individuals who've just come back multiple times?
No, that the 2,189 is single individuals. So even if you came 10 times, you'd still only be counted once in that number. So 6% of the population served were youth between 18 and 24. Over the past couple of years, we have tried to direct youth to the VOA shelter so that programming can be more appropriate to the 18 and 24-year-olds, and also that there is a greater sense of security on the part of the youth. About 21% are 55 years or older. A lot of those would still be Vietnam veterans and people like that. The actual percentage of veterans is about 13%. I think it's interesting to note that 47% of the men who come into the shelter do have cash income, and that's either through employment or retirement benefits. 67% have non-cash benefits, which would include food stamps and Medicaid, Medicare. Only 28% have absolutely no income at all, or none reported. Disabilities, only 17% report no disability. 41% indicate a mental illness, 35% alcohol or drug, and 34% of the population indicate that they have 3 or more co-occurring disabilities, which include health. There's a high percentage of chronic health issues.
This is all self-reporting.
Yes,
Okay.
yeah.
Do you make assessments as you interact with them over time?
The initial assessment is done at central intake, and so that's where that initial information would be developed, and probably not updated around those kinds of measures. Okay. So in 2013, the Ohio Housing Finance Agency allocated $32 million for a capital funding to end homelessness. About $5 million of that is allocated for Cuyahoga County, and it is intended to help repair existing shelter and transitional housing facilities. It requires a dollar-for-dollar match, and the projects have to align with continuum of care priorities. So the Office of Home Services has been working with Public Works and Lutheran Metropolitan Ministry to develop an application to do major renovations at 2100. We are working on a deadline for the application of March 31st. In 2014, the county committed $1.9 million of capital funds to repair the roof at 2100 Lakeside. And that enables us to do an additional $1.9 million of work there, which includes upgrading the electrical, masonry work, a lot of plumbing, HVAC, making it Americans with Disability Act compliant, and other health and safety repairs. So that's
Ruth, if
pretty,
I could,
yeah.
the 1.9 that you have for contracting, we have certain inclusion goals with the county, SBE goals. Because of those matching dollars, are those from the state? Do they negate our county inclusion goals?
To the chair, I do not believe so. So Public Works will be handling the contracting process for these funds. And I would think they would have to comply with our county requirements, but I can verify that and get back to you. I'm absolutely sure that they would have to comply with that. And in fact, I think the state would also support those goals, but yeah.
In the contracting for road work, the state has their own DBE.
Okay.
So although we can't use our local, they do have a DBE. So I was wondering if there was something similar with this. So
To the chair, I'll look into that and get back to you. Other challenges with 2100 or in general with the single population, homeless population, include trying to figure out ways to divert people from coming into the shelter, trying to encourage and assist with folks rapidly leaving homelessness, and advocating for mainstream system accountability, which is really a long way of saying that we're trying to reduce hospitals and the mental health hospital and the jail systems from discharging people into homelessness, particularly men leaving the prison system, oftentimes with sexual offender status, who are challenged to find housing in the community, end up disproportionately at 2100 Lakeside. So it is the basic safety net in our community. And so I think we're really blessed that we have a strong safety net. And at the same time, we have to figure out how to not be more or less of a dumping area, dumping location for systems that have resources that could be applied to resolving some of these issues. So Michael Searing, who's the Director of Shelter Services for Lutheran Metropolitan Ministry, is here today. If the committee members have any questions, either Michael or I would be very happy to answer them.
Any questions from the committee?
Can I speak to that?
Council? Yes.
Through the chair to Director Gillette, you just stated that if the hospitals would work with not dumping. So was at a meeting last week with, and I believe it was last week, I go to so many meetings, with Dr. Boutros at Metro, and that was one of the questions that I had proposed to him, had asked him, what do they do with the patients that have no homes, or so to speak, or nowhere, no support after surgery? And he assured me that that they make sure that their case management system works with the individuals to make sure that they're not put back on the street. In my determination, putting them back in the street is putting them back into our facilities that we have. So when you say hospitals, are you including Metro, all of them? Because we could bring up that dialogue, because I asked him point blank that question.
Through the chair to Councilman Conwell, Metro has been very cooperative, and in fact, one of their, I don't know if he's the director of their social work, but Mark Lehman has worked very closely with shelter representatives and the Office of Homeless Services on a discharge planning group that over the last couple of years really developed a protocol for the hospitals to use and communicated very clearly to all the hospital systems that people who are not ambulatory, who have open wounds, who, are not suitable referrals to 2100 Lakeside or to the Norma Hare Women's Center. And I'm happy to report that because of these efforts, the number of inappropriate referrals has greatly declined. It was not uncommon for people to be discharged from the ER in a taxi and sent to 2100 or, with an IV bag. It's an ongoing process where the discharge planning group is also working with nursing homes in the community who have in the past discharged to 2100 and Norma Hare. Sometimes now we are still running into problems with hospitals out of the county where they'll discharge someone from their county to our county. But I appreciate your comment very much. And but Metro, I think, has been really very much a partner in trying to be a good steward for people who are leaving the hospital.
Is this something that you see that maybe we should pull all the hospitals in and nursing homes and kind of have this discussion with you? Do you think that would help? You said Metro is being a good partner and working, but with the other ones, they're more private hospitals. Do you think that would benefit?
To the chair, to Councilman Conwell, I would defer to Mike Searing on that question. I think I would want to check back with the discharge planning group and just see if they're running into any roadblocks. But I truly appreciate your offer. That's definitely the kind of leadership that is really helpful.
Yeah, I could just add that this committee has come together and really made a lot of progress, and including Metro is looking at a pilot respite living facility of a few beds, looking at people that are not appropriate for shelter, but don't need true hospitalization. So there's quite a bit of progress being made. I would think we could take your request back to the committee and see if there's an extra kind of oomph needed. But there's been some pretty good progress with the committee.
Okay. Yeah. But that's just Metro.
The committee is, there's representatives of the clinic, usually St. Vincent, so there's decent participation, although not all of the hospitals have different levels of assistance with us, but they all do are part of the committee itself.
Majority of the hospitals are even on my board or in my district, so if you need help with doing that, because they make a lot of money. They're nonprofit. You know,
Good
I'm
point.
sure we could work something out and, you know, not just have it dumped in your lap. And plus, it's lives. You know,
Yeah.
what do lives matter? So thank you.
Thank you.
I do have a couple of questions for Director. The initial assessment, no, excuse that, that was something that you stated. Is there? Yeah.
Yeah, just to follow up, when those out-of-county hospitals make referral, are there any costs related for out-of-county when you provide service for those from outside of the county? Or are they residents of our county, just happen to be?
To the chair, we've never tried to charge anybody that comes to the shelter system. And to your point, if they're homeless, you know, how can you say, well, you have to go back to Detroit? Or, you know, I mean, it's, you know, we just bring them in. So.
Okay.
Is there case management services?
Michael, do you want to?
Yeah, I would say it's, case management is a kind of a specific thing, but it's basically a case management services. They're really focused on the housing plan, and they have both a short-term and a long-term housing plan that they receive when they do the central intake, and then our staff focus on what does it take to get them into the housing. So it's a little bit different from case management you might think of for a mental health agency that covers all different ground. Ours are really focusing on the barriers to housing.
So we all know they have barriers, because obviously they're there.
Right.
But I would just think if we had another organization to kind of, out of those 400 people, I'm just wondering, okay, we all know they need housing, but some of them have other barriers that are keeping them from that housing, whether it's drug and alcohol related, medical. So I was just wondering if we had, like, I just called it case management, any kind of
Yeah,
avenue.
correct. And I'm sorry, I didn't elaborate. The barriers to housing, that could be interpreted like a housing search, but I'm talking about the things that you're talking about. Like if their barrier is they don't have a job, then linking them to the employment services. If their barrier is they have untreated mental health issue, then linking them to mental health providers. But that's a point well taken.
And then the last, well, I'm not gonna say the last, but one of the questions that I'm just wondering, or is it documented in the initial assessment? Because if I heard you correctly, we only do an initial assessment. We don't follow back up a year later and see if things have changed or anything with that individual. And I know you get different people in, but I'm pretty sure there's a set number that are regulars. Are we connected in any way or any documentation that we know if they owe any child support payments? And then we can connect to Ms. Watson here. You know, if any of those homeless individuals owe child support payments, is there any way that you document that to know?
Service Point is our main database that all of this information comes through. And Ruth, I don't think that is a question in the Service Point. I don't believe it is.
Do you work with CISA presently?
Chair, Councilman Conwell, we have tried over, and not recently, but several years ago, tried to have meetings with CISA around how to, work with them for homeless clients, because there are, as you can imagine, I don't know if it's like 30%. We did look into it, and I can check. I think North Point, some of the men in the TH programs would have that information. We could look at it from that lens. And the issue of having been homeless, having been unemployed, now owing back, it's just trying to get I forget what it's called, to their plan, an adjustment. We were trying to figure out how to do some streamlining around those issues, but I don't think we got as much traction. So I was listening to the CISA presentation and thinking, you know, particularly now that they have the fatherhood initiative there, maybe we should go back and reopen that conversation and see if there could be some kind of a homeless liaison that would be able to kind of, you know, focus on, this is a subgroup that has particular challenges. So,
You know, I mean, just for the kids' sake, I think that would help if we could get that dialogue, because then that would bring down the number that you're going to provide this committee, where those parents have barriers, and then we can maybe work as a pilot on that subgroup for the kids' sake.
to the chair and Councilman Conwell, it's really kind of a disincentive to the men in the shelter, because to get a job, they could pay CSA, but then they're not going to have enough money to pay rent. I mean, it's one of these. It's a very tricky question for these guys. So.
Well, first of all, you know, I agree with you, but they made those children. So, but I think with the other organizations, they could work, you know, if it's something we have to talk to some state legislators or something for that population, maybe bring it down where it's fair and they can actually live on their own, because many of them do work, but we know rent costs today. They can't afford it, and then they have a barrier because they have the F because they haven't paid child support. So it's just, we're never gonna move them forward unless we have those conversations. So I think it's worth it.
To the chair, to Councilwoman Conwell, you were asking about case management, and I wanted to point out that through a contract that we have with Frontline Services, Mental Health Services, they have staff on site 24/7 at LMM in a partnership to provide services to the mentally ill clients who are identified. So, of course, you have the self-report clients, but then, you know, clients who demonstrate issues, and so there's that on site. And also the Veterans Administration have staff in the building and a separate unit with VA case management staff during the day. So there are additional resources, very, you know, targeted to folks who have specific needs there. So.
Any further questions from the committee?
Mr. Chair.
Councilman Miller?
Just a follow-up, when you talked about Frontline and the VA having people on staff, are they staffed at LMN, or are they staffed at the shelter?
Yeah, those staff partners are at the 2100 Lakeside shelter. We have offices for them.
Mm-hmm. Okay.
Councilwoman?
Thank you. What's the average length of stay for the gentleman?
To the chair, Councilwoman Brown. So this is a very interesting question. Mike had mentioned that all the data goes into this service point system, which is a HUD-created database. And then we work with a software provider called Bowman. And so far, they haven't really figured out how to utilize the logic. They haven't defined what a length of stay is. And so we aren't able to really run an accurate report on length of stay. I know you just can't believe it, right? Because we are measured on that element. And so particularly with 2100 and Norma Hare, where people are coming and going all the time, you know, their length of stay, they may live there for a year, but they may come in for a week and then be gone for 3 days, and then come in for 4 weeks and be gone for 2 days. And so you get a skewed impression. So it's between 15 and 144 days.
Yeah, I could comment a little
Okay.
further. So one of the ways that we measure, because the specifics of the length of stay is still undefined nationally. So we look at utilization, how many days a person spends at the shelter during that entire year. And so we know our total bed nights, we know our total population, and we can completely accurately count that. So that number has gone down from a high of 60 days in 2007 to the last couple of years it's been 35 days. So we've been able to cut down the utilization by about 40%. So that's the best, I would say, proxy we have to the length of stay question.
Thank you. That was very helpful. So that kind of leads to my next question. Is the 35-day like the ideal goal to get them into their own housing, or do we have an objective as it pertains to that? And I know that's probably contingent on the individuals and some of their limitations, but those that are capable, what is the ideal length of time to try to transition them into their own housing?
To the chair, to Councilwoman Brown, there's a National Interagency Council on Homelessness that has set a national goal of no more than 20 days in emergency shelter. And that's, most communities believe that that's not realistic. And however, the other way to look at it is, to develop a baseline, and, whether it's 35 days or whether it's 144 days, and to set a goal locally to reduce the length of stay relative to what your baseline is. And so that's what we've been doing here and we make those presentations at County Stat, and I can send you the slides that show how we're doing. So we have set a goal of reducing the average length of stay, I believe it's by 10% annually, so it's something to keep working at that we feel is realistic and possibly doable if we can figure things out. So I can send you those slides and then be happy to talk with you about the numbers.
Another question. You mentioned service point and utilization. Is that also how you identify the population? Because one of the things I noticed during the slide presentation is that 13% of the men that stay there are veterans, and I'm just wondering if that's a duplicate number, as they can be 55 and older as well. So how do veterans have their own separate category versus age? How do we come to that number?
To the chair, to Councilman Brown, yes, there's a separate category for collecting veterans information. It's not a double count. So those of all the clients of the 2,189, 13% were veterans, distributed through the age groups. Okay.
Close to 2 years ago, this council created a social entrepreneurship program where the Central Kitchen through Lutheran Metropolitan Ministries provides food services to the homeless shelters. How has that relationship developed, and can you give me any insight into what's going on with it?
Yeah, thank you. It's going well. For that effort, we have a culinary arts training program that draws from people who are homeless and reentry population. It has 6 months of training and then job placement at the end of that. We have an 85% placement rate for the graduates of the program. So we're really proud of that, considering who we're drawing from. We also have about 75 retention after 6 months. So people are staying at the positions, and that's a fairly high percentage for the culinary field. So we're really proud of that. Our relationships are going well. The other partners that we have a contract with for the meal provision are largely frontline, so both North Point and the Norma Herr Center. We also have some other smaller partnerships, and I wouldn't want to leave out the fact that the food bank is a key partner in this. That's where we get the bulk of our food, and then are able to provide it at reasonable rates to those partners.
Great, thank you. Any further questions from the committee?
I was just wondering if you could add that to, ever thought about the jail population, the county jail? They could service them. I don't remember if they cook in-house themselves, but have you thought about that?
Yeah, we have, we're very interested in additional contracts like that. Something like that would be huge, and it would be many more training and employment opportunities for our people. We would be open to it. The other thing would be, we'd probably have to change our model for some of those where we wouldn't use food bank food because they have specific populations and regulations, but that isn't insurmountable. The other one would be, different things, schools or Meals on Wheels or different places where there's mass meals served is what our specialty has become. But yeah, I would be interested in that, the jail food service process.
Great. Councilwoman?
Thank you. Speaking of partnerships, do we have a partnership with the Cuyahoga County Land Bank, or who do you utilize to do to try to transition the men into permanent housing?
Through the chair to Councilwoman Brown, the folks that are in the emergency shelter system, as you can see, there's a lot of low income, some no income disabilities. And so I believe the land bank operates more on redeveloping land for property owners or developers. So they don't provide any affordable housing in the community per se. So, no, we don't have a relationship with them. Yeah.
Is there a specific agency or group that you utilize to try to find housing for the homeless to transition from the temporary to permanent?
Through the chair to Councilwoman Brown. So the Housing First Initiative, which is the development of permanent supportive housing, is operated through Eden and Cleveland Housing Network. And those units are specifically targeted to chronically homeless, severely mentally ill homeless individuals. In addition to the specific resources for chronically homeless, the Continuum of Care, which is HUD funding through the Office of Homeless Services, has been awarded other shelter plus care resources or rent subsidies. So in our community, in addition to the Housing First Initiative, which is about 600 units, there's probably 1,800 units that are not defined as chronic homeless, but are available to homeless individuals with disabilities. And so over the years, we have made every effort to strategically increase the number of rental subsidies available to this population as a way to move people out of homelessness. In addition, there's a number of transitional housing programs in the community, and for those who are not seriously disabled, clients are linked with those beds, and then in a transitional setting, they're able to focus on employment, job readiness, and the concept is they will then move from there into their own unit, get a job, save some money, and then move out. So it's an incremental approach. For some men who don't want or need transitional housing or don't qualify for the permanent supportive housing, as Mike indicated, there's efforts made to link them with jobs so that they can become employed, get some income, and again, move out on their own. So that's housing is a big focus, but it's more in terms of rental housing, figuring out a niche and or possibly family reunification, if that's appropriate. If people can resolve whatever behavioral health issues they have that made them separate from their family. So those are some of the options. Thank you.
If I could add one item related to the land bank, Ruth described the continuum, and the land bank doesn't really have a specific role in the continuum, but we found them to be flexible and innovative and work on different pilots and partnerships. We're actually working on one right now where we're gonna, we've received a duplex from the land bank. It's going some renovations, and the goal will be for it to be extremely affordable, independent housing for veterans in particular, leaving the shelter. So that's not a specifically like a continuum funded program, but it's going to serve the continuum. And if that pilot goes well, as we hope it does, then we could replicate it with additional houses. Yeah.
Any further questions? Excuse me. If there are no further questions, I'll make a motion that we move Resolution 2015-0053 to the full council under second reading suspension.
Second.
Moved and seconded. All in favor, say aye.
Aye.
Ayes have it.
Thank you very much.
Thank you. Thank you both. All right, that brings us to the end of our committee items. We have one miscellaneous business item, which is a presentation from Mr. Bob Sprague, the Director of the Alliance of Child and Family Service Providers. Welcome, Mr. Sprague.
Welcome, and thank you, Chairman Jones and members of the committee. I am Bob Sprague, and I am the Director of the Alliance. And I'm here with a couple of our member agencies to just introduce you to our Alliance and its members and services that we provide in partnership with the Cuyahoga County Department of Children and Family Services. We are an association that began in the 1970s with a few agencies that came together to share ideas and speak in it with a collective voice when it came to matters of quality of service to children in Cuyahoga County and improvements to the system. So our main goal, our mission, is to provide the highest quality of service to children and families and to act as an advocate for improvements to the child welfare and behavioral health care systems. In the beginning, the membership of the Alliance was small and consisted mainly of agency executives who would volunteer their services as board members of the Alliance. And the idea was to get together, share common ideas, solutions to problems. These agencies that initiated it were very experienced in working with child welfare cases and wanted to share their expertise with other agencies. They also wanted to develop and initiate a close partnership with Children's Services or Department of Children and Family Services and the Juvenile Court, where they received most of their referrals from. So in the beginning, it started small, but as you may be familiar, in the years of the 80s and 90s, referrals for out-of-home care from the Department of Children and Family Services literally skyrocketed. We're talking about thousands of children that were in out-of-home care. And the partnership and the ability to interact with the department and our member agencies became very, very critical. So the Alliance grew. Our membership grew, and they went from a volunteer staff to a full-time paid director at that time. And that partnership was developed on trust. And that was trust between our member agencies and a very skillful director of the Alliance and directors of the Department of Children and Family Services, where we began to be able to have a partnership which allowed us to meet on a regular basis. All the executives met on a monthly basis, as well as we had staff and members of the executive committees working on many committees and panels to work on problems and issues that were common between our agencies and the department. I can't tell you, I have 40-plus years experience throughout the whole state of Ohio and nationally, and I can tell you that the partnership that we have here is something very unique and something to be very proud of. Not that we're the only organization that does this, because there are others in the state of Ohio and nationally, but not many that I know of that have this trusting relationship where we can sit down on a regular basis with members of our public partners and ourselves and basically share problems and bear issues that we have that will result in hopefully solutions for the children that we work with. Solutions to problems like transitional youth, those aging out of the foster care system. You know, how are we going to stop them from coming into homeless shelters? What are we going to do to prepare them for life as adults? A very large problem, although percentage-wise quite small, are working on youth that have multiple system involvement, juvenile court involvement, mental health involvement, and child welfare involvement. These youth are oftentimes in residential treatment centers throughout the state of Ohio, and they need to come back home. And when they come back home, are they going to go to foster care? Are they going to go to treatment foster care, independent living services? How are we going to address that? These are not only problems that the department faces, but problems that private agencies face also. So I feel very happy to be part of that process and to be able to sit on some of these committees and panels and work together with the agencies to solve that. Times have changed, and the number of children served by the Alliance agencies has decreased. And now from the 80s and 90s, where we were talking about remarkably, I think in the area of 5,000 to 6,000 children in out-of-home care at any one time, down to below 1,300. And this is a good thing. And this is a result of best practices within our social service agencies that look at reducing the number of children that they have to remove from families. If they have to remove a child, working together to reunite that family as soon as possible through increased visitation and support services to the parents. And for those children that are unable to be reunited, to work very closely with permanency issues for them, either adoptive services or moving on to independent living services, if at all possible. These are not only Cuyahoga County problems, but these are national problems also, which I think is very helpful when you look at the membership of our alliance. And I did provide you guys with some very basic information about us, which includes our membership. It's comprised of small agencies as well as agencies that are rather large. Some have a national presence as well as a statewide presence. So they bring expertise from other areas of the country as well as from other areas of the state in looking at trying to solve some of these problems. We continue our very strong partnership with Cuyahoga County Department of Children and Family Services. Currently, we're looking at about 75% of all the children that are currently in out-of-home care, such as foster care, residential treatment centers, and independent living, are served by private agencies in Cuyahoga County. We remained actively involved with the department, serving on panels and committees to help update the tools used by the department to assign levels of service to children, help us better define the roles of public and private caseworkers so that we can work more closely together and efficiently, and more recently serving on an interview panel which will be hopefully making some recommendations to the full county council on a replacement for the vacant director's job at the department. I have with me today two representatives from member agencies who will briefly describe their programs also, and afterwards we'd certainly entertain any questions that you might have. In addition, on behalf of our membership, I would like to extend an invitation to any of the members who would like to visit any of our agencies, whether they're in your wards or not. The contact information is included in the information I gave, or you can contact me and I will be happy to assist in making those connections for any visits that you might want to have. So I would like to ask my two member agencies to step forward and give you a brief description of their programs, unless you have some specific questions for me before I do that.
Any questions, Councilwoman?
Well, I guess if you wait to after all.
Okay. Yeah, Lisa?
Good afternoon. I'm Lisa Allman. I'm the program director of Presley Ridge. I did provide some information for you regarding the services that we provide. Presley Ridge is an agency that is based out of Pittsburgh, Pennsylvania. We were founded in 1832 and have been in the Cleveland area since about 2002. The program that we provide to Cuyahoga County is treatment foster care, and with that we're working with children and families that have significant issues around behavioral and emotional health, a lot of trauma, and working towards reunification with families, if that's possible. Bob spoke a little bit about other options such as adoption and independent living. Those are pieces that we provide as well. We service about, at any given time, about 40 children and then about 80 children a year through our foster care program. And part of our role is to really recruit and train and license the foster parents, which is one of the most difficult pieces, is finding parents that have the time, have the abilities to provide a home for children that have some significant behavioral and emotional problems and a long history of trauma. And once we have recruited and trained foster homes, we provide ongoing training to those parents in the home. We have case managers that are in the home every week and provide a significant amount of training to the parents specific to each child that's in the home. And then they're also providing case management services to the children and families if the family is engaged. And those services would be things such as engaging schools, working towards getting an IEP possibly, looking at different placement options, providing and referring for mental health services, psychiatry services. We do provide those types of services as well. We have a psychiatrist who comes in once a month and sees our children, and we do have a therapist that can work with our children, our families. Sometimes they work with the foster families and the children together to provide a stable home for them until that time they're able to be reunified or adopted.
Sure. Yeah, hello. My name is Matthew Mott, and I am the Director of Business Development for Foundations for Living. Foundations for Living is a secured residential facility for both boys and girls between the ages of 11 to 18. The average length of stay is roughly 180 days. We do have a total of 6 units, and we can house up to 84 kids at any given time. 5 of those units are for our girls, and one of the units is for our boys. The services that we do provide are mental health therapy, drug and alcohol therapy, and also behavior health therapy as well. We do have a 45-day assessment program where we do provide assessments for children that do come to us and provide recommendations after that 45 days of where what we believe needs to continue with the child's care. We also work with kids that are victims of human trafficking, children that are self-mutilating, children that have reactive attachment disorder, along with quite a few other things. Now, with the kids that do stay there, they do stay with us until the treatment is completed, and they don't go anywhere unless they are with one of our staff. With that, we do have our own schooling there as well, which is contracted through Mid-Ohio Education. These are certified teachers that, where the children do go to a classroom setting with the teacher that is provided and are actually able to get more credits than they would in a regular school, like a regular public high school. Which does help them quite a bit once they are released back into their home of where they came from. Other things that we do provide for our children is transportation, which means that we do go pick family members up to bring them back to the facility for family counseling, for visitation. We also do provide transportation for court hearings, also family team meetings with children's service agencies, and semi-annual reviews as well. We do provide a individual service plan for each child with a tentative release date once they have finished their therapy. Also, we do modify that every 30 days with the treatment team, which includes parents, probation officers, other therapists from where they come from, so that they have an idea of what exactly is going on with them and that they are prepared for that child to return. But that's about pretty much it.
Okay.
Those are the other-
And you both contracted with the county, both of your?
Yes.
Yes.
County. maybe take a moment and share with us how the Alliance of Child and Family Providers has benefited your organizations?
I think it's been a tremendous benefit. We've been a member for about 10 years. Not all, I haven't been there that long, but we have had a very good relationship through the county because of the partnership. There's been a lot of issues. Bob talked a lot about the number of children. When we first entered the Alliance, the number of children that were in foster care was staggering. But being able to work with the county to help reduce that, to help work with just different issues that have come up over time. Things about working relationships between our staff and their staff. Things about working towards reunification, like moving things along, getting visits facilitated, getting court dates moved up, getting services for families, working with case plans. So all those kinds of issues are things that we've worked with the county to help reduce the length of stay for our children, to increase the number of reunifications, to increase the number of adoptions. Those are some examples, I think, of how it's been very beneficial. And I feel like it's the kind of thing that in the future, when issues come up, that I feel very confident through the Alliance and through Cuyahoga County that we can work out those kinds of issues as well to help our children and families.
Yes, I have to agree with all that. It has strengthened our relationship with the county as far as when they need services, to the point to where if they do need to have something other than foster care, that they need to go the extra services as far as residential, then they definitely have a good contact with us as far as immediate response.
Okay.
Can I answer that too, Chairman Jones? Because I would be one of the.
You're answering how they are benefiting from your.
I would be one of the only people that's still in the Alliance old enough to have been involved in the 1970s. At that time, I was working for a nonprofit agency, and I found it extremely beneficial to be able to sit down with my peers at that point and argue out issues. Because as you are all aware, I mean, these are all individual agencies, all of which have their own businesses, their own items that they consider important. And when you get together in the same room, if you want to come together and have a commonality that you can take to any place, there's arguments that have to happen. And I found it very comforting to be able to go together and have those discussions among ourselves and then come out later on and say, well, yes, we all agree on this, whatever this is. So I felt even from the very beginning that it was an extremely beneficial thing to be involved with the Alliance as an executive in a nonprofit agency. And I had leadership positions both at my agencies and in the Alliance over the years that I felt were very beneficial to everybody. So I wanted to speak to that. Thank you.
Okay. And earlier you spoke to the fact that we are still searching, the executive is still searching for a director of children and family services. I'm going to softball you an opportunity since they are searching. Anything you'd like to share and what you think would be an excellent asset in the next director of children and family services?
Well, certainly, I think the ability to maintain some great communication skills, not only among us private providers, but among the department, I think would be very, very critical to that position, as well as obviously a great deal of experience in trying to solve the challenging problems that we look forward to here in the balance of this year and the next. So I certainly would be looking for those kind of assets, in a candidate.
Okay, thank you.
Chair.
Councilman Miller.
For Presley Ridge, the 40 youth, are we talking just at the Cleveland facility, not in any of your other facilities outside of this area? Is that?
Yes, that's just for the Cleveland area. And about 98% of the children we serve are through Cuyahoga County.
Mm-hmm. Okay, and for Foundations for Living, could you review the numbers you gave as to how many children are typically served?
As I said, we can serve up to 84 kids at any given time. Usually, the numbers are roughly anywhere from 50 to 70 is how many kids we're serving every day. As far as bed holds or as far as waiting lists, the only time that we would ever have that would be for units that deal with the drug and alcohol, the dual diagnosis, drug and alcohol, mental health. And that's for both the boys and the girls. But as far as other beds available, we've never really had any waiting lists when it came to providing services for anybody.
I've heard it said how difficult reactive attachment disorders are to treat. Could you provide some insight as to whether reactive attachment disorders can essentially be cured in some circumstances, or is the best that you can do to help the children deal with it to some degree, or is even that a stretch?
As far as reactive attachment disorder, what we do is we train our staff, and we also train our therapists that these children, when they're acting out because throughout their whole lives, it's just been something that they've always been disappointed in those who have provided care for them, or those who are supposed to be their support, like moms, dads, other mentors and stuff like that. They've just left their lives. So once they start getting attached to somebody, they end up starting acting out to push them away so that they don't have to deal with that themselves. We just make our staff aware of those situations and teach them how to talk with the children that no matter what it is that they do, they're not going to be able to push us away. They're not going to. They can depend on us. They can look to us for help. That's the reason why that they are there. It takes very strong, very patient, very strong people just in order to work with children like that are a reactive attachment disorder. So it all runs into encouragement to get them through those hard times so that they don't have to continuously act out in order to push people away. I hope that answered your question. It probably did.
Okay.
And, Councilwoman Brown?
For both agencies, is reunification the primary goal?
Reunification is always the primary goal, if possible. We serve about half of our children have a reunification plan, and about half are in permanent custody. So there will be no reunification plan. Whenever possible, that's always the first choice, if they could be returned safely.
As far as Foundations for Living, the people that we work with, the children's service agencies, the juvenile courts, they usually hold custody of the children.
Okay.
And understanding with both juvenile court and children's services, reunification always is the first plan for every family. So whatever plan that the counties do have, we work that plan. If it is reunification, that's what we work on. If it is the child's going to end up going to foster care or step down to a group home, we work that plan so that child is prepared for that step.
Thank you. Also, I was looking at the list of members provided by the Alliance, and are you new to the Alliance? I don't see you listed.
Yeah.
Okay.
Yeah, Foundations for Living is fairly new to the Alliance. Foundations for Living have been going to the Cuyahoga County Children's Services Provider meetings for years, but as far as being a part of the Alliance, we are fairly new.
And how do you become a member of the Alliance? I guess that would be a question for you.
Yes, well, you have to be a nonprofit agency, and you simply make an acceptance to our board, and the board looks into the agency to make sure it meets the criteria, serving children and families, basically, in Cuyahoga County, and are a nonprofit agency. At this point in time, we don't have any membership dues. It is simply based on those criteria.
You. And then if I may, Presley Ridge, you said the average length of stay is 15 months. Do you also, I know that Mr. Mott indicated that they have school. Do you offer a classroom alternative or environment, or are the children still integrated into their regular schools? Could you elaborate on that, please?
Yes. No, the children are integrated into whatever school district they're placed in through the foster home. Many of our children do attend alternative schools, positive education program, education alternatives, if their needs exceed what the school district can provide.
Okay, thank you.
Councilwoman?
Through the chair to whoever can answer. Basically, I wanted to know, Palmerdale Children's Home closed a while back. I was just wondering if you received some of those children from there, from the residential treatment center, I believe.
Yes, we did at the time that they did close. We did receive some of those children.
But not all of them.
No. There are so many residential facilities that are in Ohio at this point that they went to wherever their services could be better benefit.
Okay. Thank you.
Right, and some of them, I believe, did leave and go into foster homes. I know we served one child that left the residential center that had been ready to step down into foster care. But I believe many of them did go into some other foster type settings as well.
Any further questions from the committee? All right. Well, we thank you very much. As this the new committee at the beginning of this year and new chairmanship, we've been reached out to by so many nonprofits and organizations doing critical work, and this is just part of that effort to allow as many as possible to come in and make themselves familiar with us and this committee. So we thank you for coming out, and we appreciate your input.
Well, thank you very much for the opportunity to do it.
All right, thank you. Chrissy, has anyone signed in for public comment?
Yes, Mr. Chair, Ms. Liu.
Mrs. Liu? Mr. Liu, if you'd like to come forward.
Hi, good afternoon. I'm Lou. This is not my first time coming to attend the meeting. Basically, I'm new to this. I came to observe. So now I know I do have a chance to also voice my individual opinions or observation, and I'm glad to have this chance. Unfortunately, I'm not a politician, and I'm not a representative from a business organizations or some like service provider. So I may not say things you want to hear. This is what I have got from my 2-3 times coming to this meeting. Earlier we have this presentation, and I noticed the people up here, you guys actually asked good questions, but some of the answers may still be something they think you want to hear. This particular project actually serving more people than they put it on the paper. I think we should tell the truth, not to be modest at a certain time. So this is a very good, important project. Even I myself wouldn't be the one directly benefited from this, okay? But certain things they presented, when you guys ask certain questions, like how hospital operates, actually the answer from my observation, there's no way for us to know people staying in these facilities, not only this one, same type, which hospital they will be sent to. So sometimes they can be discharged from any of them, not only outside the county. That was a good question you asked. Even in the county, we have noticed because of the bed availability or whatever operation in the hospital, they do tend to discharge homeless people way sooner than non-homeless people. So they will be kind of dumped back to shelters. This actually happens. About the case management, unfortunately, the gentleman, he said 24/7, which is not true, not his fault. His impression will be there, but unfortunately, we found out they have office hours. So lots of times, even you need help, nobody you can reach. So lots of things they offer, not only at this location, in other location, there are big gaps. And unfortunately, I myself and others, we also have noticed, if right now this is considered a service or you really want to run it as a business, then maybe you should really think it's a business to help or it's a business to manipulate politics. Housing assistance or some other assistance they offer, sometimes it became not just a simple help. It became a baggage, creating more troubles for homeless people. I know I only have 5 minutes or something. That's why I left my phone number there. If you think you do need to find out more of the real lives homeless people have been encountering for, let's just say 10 years. I don't know about it long time ago, but economy has changed, society has changed. Nowadays, you don't have to be uneducated or substance addicted or lazy to be homeless. I have seen a lady, she lived in an apartment building without any trouble for either 7 to 8 years or 8 to 9 years. That means she always paid her rent. That means she didn't violate rules and regulation, but she became homeless. Why? Because the whole building was under foreclosures. The management of that building at that time didn't tell them until 4 days before the bank actually had to take action to sign over the building. So she became homeless because nobody in that building could arrange a new place to go in 4 days and pack up all your stuff or, get your paperwork together. Believe me, the burdens on homeless people has been really way over whatever they presented here. It's more than that. The people presenting these informations, they are not wrong, but they don't go through these things each one themselves either. So I think if you really have the heart to help, because lots of them are your voters, if you really want to help, because you have the power, you sit up there, please do. Thank you.
Thank you. All right. Well, if nothing else holds our attention, our meeting is adjourned.